Before we get started, I just want to make sure to point out that at the entryway to the door is the sign-up sheet for anybody who wants to speak during the public comment section. So again, I just want to make sure people are aware of that, that's the sign-in sheet, which we'll pull later to make sure to call any names if anybody wants to speak to the commission or make any public comments. So thank you very much. You guys all ready? All right. All right. All right. And with that, we will go ahead and start today's meeting of the Kentucky Opioid Abatement Advisory Commission. We'll begin with the roll call. First, Commissioner Allen.
Here.
Dr. Brenzel.
Present.
Representative Fugit.
Here.
Director Ingram.
Here.
Treasurer Metcalf.
Here.
Commissioner Oser.
Present.
Commissioner Purdy.
Present.
Commissioner Rains.
Present.
And with that, we have a quorum, and we'll go ahead and move forward with today. Thank you. With that, I'm going to ask for a motion to approve today's agenda.
So moved.
May I get a second?
Second.
All in favor?
Aye.
Any opposed? The motion passes. Next up, business meeting schedule. For the regularly scheduled meetings of the commission, the next meeting is August 18th, 2026 at 1 p.m. at Western Kentucky University in the Dave Chandler Hall. After that is September 3rd, 2026 at 1 p.m. here in the Capitol Annex at 702 Capitol Ave in Frankfort. And the third meeting for this year, the next meeting for that will be November 3rd, 2026 at 1 p.m. here in the Capitol Annex again. So that is the upcoming business meeting schedule. I will get to some other meetings of the commission in a moment. Next up are the minutes from our last meeting of April 21st, the business meetings. Hopefully you all have had the opportunity to review those meeting minutes. And may I have a motion to approve the minutes?
So moved.
May I have a second?
Second.
Any discussion? All in favor?
Aye.
Any opposed? The motion passes. Next on the agenda is the Executive Director Report. A few items to update the commission members and the public on. First of all, I want to start off by acknowledging one of our former members, Dr. Trish Freeman, who has rolled off the board, who's doing well, and we want to make sure to thank her for her service and the dedication she brought to the commission. And we have, replacing her is Dr. KYOAAC, who is on with us today, and I'm going to give this opportunity to her to introduce herself to the rest of the commission and to the public. Dr. Oser?
Hello, everyone. My name is KYOAAC. I'm a professor in the Department of Behavioral Science and vice chair in behavioral science in the College of Medicine at the University of Kentucky. I'm also stepped into the director role for the Center on Drug and Alcohol Research starting July 1st, and I'm pleased to be here. I'm an addiction health services researcher, and I look forward to working with you all.
Thank you very much, Dr. Oser. We're happy to have you with us. Next up, I want to make sure that the commission members and the public are aware that the Better Without It evaluation notice of funding opportunity opened on July 29th. This is something that the commission had interest in, and we wanted to make sure that there was clarity. And the purpose of this funding and evaluation to support a comprehensive, independent evaluation of the Better Without It Kentucky initiative to assess its implementation, reach, and overall effectiveness among youth and young adults in Kentucky. So that notice of funding opportunity just opened up on June 29th, so I want to make sure that all members are aware that that process is ongoing. Next up, listening sessions. We will be having a series of listening sessions in addition to the meetings that I mentioned earlier. And I want to make sure we've got the proper dates for you on that. This has disappeared from the notes here. Thank you. First meeting is going to be July 13th in Highland Heights, Kentucky at Campbell County Extension Services at 3500 Alexandria Pike, Highland Heights. That will be followed on July 30th in Richmond, Kentucky at Enrich at 110 South 2nd Street in Richmond, Kentucky, and followed with the third one in Shelbyville, August 4th at 11 a.m., North Central District Health Department, 1020 Henry Clay Street, Shelbyville, Kentucky. So again, in addition to the regular scheduled meeting of the commissions, those public listening and comment sessions are available, and I want to make sure not only the commission members, but in particular that the public is aware that there will be additional opportunities to hear from the commission and to make comments to the commission. Next up is I want to make sure that everyone is aware that the local reporting portal on the spending of settlement funds is now open and will be open until August 31st. So that process has now begun again, and we will begin to collect the information and data from counties and municipalities on their use of the settlement funds. And last, in terms of my notifications, I want to make sure that people know that this year's opioid symposium tickets are now open and available for sale. The symposium is going to be in Owensboro on October 5th and 6th, and you can go to the website for the commission and find additional details there. So we want to make sure that everybody is aware of those upcoming things and items of notice. With that, we will move into the exciting portion of today's event. Next up, we're going to have a report from the Radar Kentucky team. As the commission knows, there was a question and issues of wanting to make sure that we're informed, understand where the dollars go and flow throughout the Commonwealth, and to have clarity on what that looks like. The commission approved the effort to partner with the University of Kentucky, and we have been privileged to have an outstanding group of individuals to help guide that process and make that a reality. So with that, I want to turn the mic and the stage over to the member of the UK teams. I'll let them introduce themselves and to give the commission the update on the dashboard, which is going to be rolling out immediately.
Thank you so much. Hi, everyone. My name is Lindsay Hammerslag. I am an assistant professor in the Department of Biostatistics in the University of Kentucky College of Public Health, and I'm joined by my colleague, Dr. Margaret McGladrey, who is an assistant professor in the Department of Health Management and Policy in the University of Kentucky College of Public Health. So what we're going to do today is we will first walk through a quick demonstration of the dashboard, including orientation to some of the features of the dashboard and a live demo. And then I'll turn it over to Dr. McGladrey, who will show you a use case demonstration and help you understand how you can start taking action with this dashboard today. This dashboard was created with the goal of supporting transparency and empowering community members to make data-driven decisions, to monitor spending in their communities, and to ensure that they have access to data coming in from our municipalities and counties around the use of funds, as well as information around the grants that have been awarded by the Commission. As you know, the Commission funds grants and other investments, and there are also funds given directly to counties and cities. And so this dashboard is designed to give summary information about both of those sources of information. The main page of the dashboard is the impact page. So this is what you'll see first if you were to navigate to our site, and I'll give you a QR code for that a little later when we get into the live demo. So this first page will show you summaries of how funds are being used across the Commonwealth, and it includes boxes and information focused on different sources of funding. So the funding sent directly to counties and administered by those counties, funding sent directly to cities and administered by those cities, and funding administered by the trust fund through grants and other investments. The summary boxes for our counties and cities include information not only on the amount that they have received, but also on the amount that they have dispersed. So as you can see here, at the end of fiscal year 2025, our counties and cities reported investing and dispersing $12 million for counties and $2 million for cities, respectively. We also summarize investments in our awards and other investments through the Commission, as you can see here. And so this is a summary of all of the awards that have been given over the past several years. As you continue through the main page, you'll see additional information, including maps that you can use to engage with county-level information. And so one thing that you can do as you navigate and click around is you can interact with this map and click on counties to get more information. I'll show you that in a minute. Another way to view details by county is to go to the community funding page. This is going to be your gateway to detailed information about how funds are being used within each county. And so just like the main page, this is structured with a focus on county funding, and then any cities within that county that received abatement settlement funds are also summarized separately from the county funding. And then any trust fund awards that might benefit that county are summarized there. If you wanted to get even more detail, you could click on this invitation to view the dashboard. So here we're looking at Louisville Metro Government, Jefferson County. So if I were to click on this button, I would be taken to the community profile page for that county, which looks a little bit like this. Each county has a community profile page with details on the use of funds within the county and any cities related to that county. So for Jefferson, we are reporting 17.9 million was received by the county as of their fiscal year 2025 local report. And the 7 cities that received funding within Jefferson County reported receiving a total of $470,000 as of the end of fiscal year 2025. As you go through the community funding page, the community profile page, you can get even more detail on the use of funds by these individual counties and cities. So if I were to click and expand this item for Jefferson County, I can see the individual line items that they reported in their local reporting for fiscal year 2025, including the name of the recipient and the amount. I can also get insight into the amount of funds that were unspent as of the end of fiscal year 2025. And so I'm only showing you a small snapshot of the recipients of funding from Jefferson County. As you can see, they funded $5.9 million to 26 programs in fiscal year 2025. So you can get more information if you were to scroll through the site. Below here, you can see cities within Jefferson County. So just as I had clicked to open this, I would have been able to open and look at individual cities and how they had reported dispersing their funds. So now we're going to transition into the live demonstration. Give me one moment to adjust my screen sharing. If you want to, you can scan the QR code on the site here. I'll give you a moment for that. Or you can go to kyoaac.ky.gov/dashboard. Okay, so I'm now sharing the kyoaac.ky.gov homepage. Our team has been privileged to work directly with the Commission to design, develop, test this site over the past year and the new impact reporting page here. So this is the dashboard that is launched today. It's accessed through the homepage. Went a little fast there, I'm so sorry. It's accessed through the homepage by clicking on About and then the Impact button. Here you see that impact dashboard, that first page with top-level summaries of Kentucky at a glance, and our maps. Those maps are fully interactable, so you can go and click on a county if you wanted to learn more about that county. You can also click to adjust the filters and what's being shown on the map. So for example, if you were interested in funds that have been dispersed by counties, you might click this button here, total amount dispersed. And you can see the darker counties are ones that have dispersed more funds total compared to lighter counties. And you'll note that there are some with zeros that are showing as white. You can do the same with cities, although we will note that for any given county, all of the cities together are presented here. So if you'd like to get more detail, you would want to go ahead and click on that county to get a more detailed breakdown of funding use within individual cities. Coming back down on the impact dashboard, you can see additional information about the amount of funds that have been received, how the funds are being used, including the reported purpose of the funds. Here we're able to look at our trust fund awards that were granted with under the categories of treatment, recovery, prevention, or other, as well as reported use of local funds that was designated as having a treatment, recovery, prevention, or other purpose. I'll let you guys explore that further on your own. The second page I'd mentioned in my overview was the community funding page. This includes summary information on a county by county basis. I invite you to play with the buttons to adjust the sorting and filters. you had seen in my initial orientation the data for Louisville Metro government. You can scroll down to see additional counties and counties. You can also search for an individual county if you needed to, or even a city. So if I were to search for Jefferson, I can get that. Let's see, you can search for any given county. And then you'll see here that by searching for Madison, I was able to pull up not just Madison County, but Hopkins County with their city of Madisonville. So you're able to search through to find the city or county that you're interested in with this tool. I'll now show you that more detailed page focusing on an individual community. And thank you to Louisville Metro government for having a very rich page for me to look at here. It's been very nice to focus on. And so you can see as you're zooming in with more detail, we have a summary of use of funds by this county, with Jefferson having spent $17.9 million and having received $17.9 million and dispersed $5.9 million. And then we see the collapsed information across all of the 7 cities reporting data. We can scroll down, and as you had seen in my orientation, we have the use of funds by Jefferson County, along with some statistics about availability of funds. And you can see all of those individual recipients. In the months to come, and the weeks to come, our team will be adding in the ability to download the PDFs of the local reports for each fiscal year. And in the year ahead, we plan to enrich the data from prior to 2025, as well as the 2026 data coming in soon. So this is going to grow in the depth of data available to you. When there are municipalities without recipients, you'll see a notice of that. And finally, if you want to look through individual awards through the Kentucky Trust Fund or line items for individual recipients, you can search through those on the search tab. I'm now going to take a moment and adjust my sharing one more time so I can hand you over to my colleague. One more second. And so I had mentioned that one of our goals here was to empower community members, and my colleague Margaret Gladry is very focused on that. And so she's going to walk you through a way that she envisions using the system to take action.
Thank you so much, Dr. Hammerslag. I really appreciate the opportunity to be able to not only share the amazing work that's happened with the dashboard, but also how we're envisioning potential use cases for community members, constituencies, applicants for funds to be able to use this dashboard to improve the responsiveness of their application and proposals to the needs of their communities. It's also wonderful to see friendly faces in this group, so many dedicated folks to addressing the opioid epidemic in this room. So wonderful to be here. So we're going to take a look at a scenario where Monroe County is applying someone in Monroe County is applying for funding from an abatement fund source, right? So maybe the state, maybe the local level. So put on your imagination hat and imagine you're the executive director for a community-based organization in Monroe County that is seeking state and or local abatement funds for a comprehensive overdose prevention program. So that might include naloxone, harm reduction, linkage to community-based treatment, and peer support for people being released from the Monroe County Jail. And you would like to use the dashboard to strengthen that proposal. So the 3-step process that you could follow in order to use the dashboard for this kind of use case and purpose is first that you would want to confirm alignment of your proposal with local and state funding priorities and allowable uses for the opioid abatement funds. Second, you'd want to identify indicators demonstrating the local need for this program. Third, you'd conduct a gap analysis to ensure your proposed program is not duplicative of other services offered in your county or your region. But an important caveat here is that prevention and treatment activities that are not funded by abatement dollars are not yet captured in the dashboard, right? So we're only seeing what has been funded and invested in by local, city, or state settlement funds in that dashboard. Does not include, of course, core funded activities, other sources of funding in this dashboard at the moment. So with that first step of the process, you'll be confirming alignment with two different kinds of priorities here. First, of course, the KYOAAC funding priorities if you are seeking state funds for the current cycle, and I'll show a screenshot of that in a minute here. And most importantly, that the proposal is aligned with opioid abatement funds as specified in the National Settlement Exhibit E and Kentucky Revised Statutes. And one way to strengthen your proposal from kind of an explicit flagging of the alignment is to state how your proposal aligns with those allowable uses in your presentation, your proposal materials as you're pitching this idea for a program in the Monroe County Jail. So the way that would look as you're executing step one here with this use case, hopefully, if the slides, okay, they moved along here. We have two different screenshots. On the left here is the funding priorities for prevention and treatment and recovery that were enumerated and prioritized by this commission for the last state funding cycle. So these are not the current application priorities, but this is what you would see if you are considering applying for funds for the next cycle with that NOFO that is posted on the website. You would see what are those priorities for funding within the state abatement space. And most importantly here, you would be looking at Exhibit E and Kentucky Revised Statutes at the list of allowable uses to crosswalk your proposed proposal of a program for the jail to those allowable uses, maybe several of the allowable uses. And we include in the slide deck here with the previous slide links to the Exhibit E National Settlement as well as Kentucky Revised Statutes, and all of those resources are also available, easily accessible on the Kentucky Association of Counties website for the allowable uses piece. But that's what it's going to look like when you're exploring step one. The second step that you're going to take in proposing this program for Monroe County Jail is to identify indicators demonstrating the local need for this program. And as you might have saw on the dashboard as you're playing around, we not only include this impact dashboard that the Radar team has been working on to display what's happening with local and state funding, but it also now integrates Radar data. And Radar is a really exciting initiative that I know a lot of you have heard about, of real-time surveillance data that the bioinformaticists and epidemiologists with the Kentucky Injury Prevention Research Center have been developing to be able to know in real time from multiple data sources what are we looking at the county level in terms of overdose deaths, non-fatal overdoses, MOUD utilization, MOUD, medication for opioid use disorder retention, naloxone distribution, all these important indicators for prioritization and decision making, as well as evaluation of the impact of our programs, right? So we can use these data from Radar not only to understand what the local need might be, but also down the line, whether the program was able to move the needle without having to do any external kind of collection of those data, right? You can come back to the dashboard and use that as kind of a post-test of where your program has made an impact. So in this case, the executive director is looking at the data and they're seeing that Monroe County seems to have a higher EMS event rate compared to surrounding counties. So let's drill down a little bit from that initial visual here. Drilling down and clicking onto Monroe County here, when you look at number 2 on the screen, you see that Monroe County has a spike of 6.8 EMS events in March compared to 10.4 of those events statewide. So interesting. Let's dig a little bit deeper. Another piece of data that was useful to this executive director in identifying indicators demonstrating the local need is looking at the rate of naloxone distribution. So of course we have on the left here from the Radar dashboard, again, integrated now with the Commission's website, is the statewide rates that you can see kind of a snapshot of what naloxone distribution saturation looks like and doesn't look like by a county level. And then you go ahead and click on into Monroe County. And what you find is that the distribution data for naloxone is suppressed, of course, with a small population size. size, but even with the suppression, this is less than the statewide average of 168.4 two-dose units per 100,000 residents. So we have a pretty strong indication from the radar data that there's a need for an additional kind of focused effort to address overdose rates and naloxone availability, especially at that high risk of point of incarceration as folks are returning to the community, maybe with decreased decreased dependence on opioids. Let me go ahead and screen here. Or decreased tolerance, excuse me. We know from the jail perspective, as folks are leaving the jail for their community, decreased tolerance for opioids and a higher risk of overdose when they return to their community. So after you've done step 2 to identify really whether there's a local case for this kind of program that you can use in your grant application, you're third going to conduct a gap analysis. So the first step here is to search the dashboard to see what programs have been funded in your county of service, in this case, Monroe County, and asking the question, how does your proposal fill a gap for your target county in the prevention, treatment, or recovery services that have been previously funded at the county, city, or state levels? And then the second question you want to answer is, how much funding at the local level remains unspent in this county? And again, as a follow-up question, given this amount, based on use of the dashboard that Lindsay demonstrated, and what you've learned from the gap analysis, how much would be reasonable to request for your local government allocation? So you could complete this sentence in making your case for this program funding. We have how many number of dollars remaining in the county funds from which we would like to request X number of dollars to support our application, right? So being able to really make a clear argument that we understand the overall investment portfolio at the county level and what proportion do we feel like is feasible and reasonable to execute this program based on the overall portfolio. Then the next step here would be to search the dashboard to see what programs have been funded in surrounding counties and confirm the need with implementing partners. For example, in this case, the jail. Does your program provide unduplicated services? So again, it's important here, especially when partnering with an agency or a setting for implementation, to confirm that this is in fact needed, that it isn't being provided by other sources in this case, and to also be able to develop that partnership to show the feasibility. Yeah, the jail's on board, right? We're ready to go with this program if we were to receive funding. So for the gap analysis then, what this would actually look like when you're executing step 3, so you check that community funding page for Monroe that Dr. Hammerslag broke down. So you go to that community funding tab, you'd go to view the dashboard for Monroe County, click view dashboard for Monroe. And what you would see is that $10,000 allocation has been made for county funds and no spending has been made of city funds. And you can look down, as Dr. Hammerslag showed, the list of different funding commitments. In this case, we see the $10,000 has gone to the Monroe County Health Department for prevention activities. The next step then would be to take a look at surrounding counties for their efforts. As we know in Kentucky, a lot of services are grouped and funded and provided at the regional level rather than the county level. So let's see what's happening in the surrounding counties. We look at Allen County, Cumberland, Metcalfe County. 2 of those 3 have not spent any funds yet, so you wouldn't be duplicating those abatement-funded efforts. And Metcalfe County has spent funds on prevention rather than the treatment and recovery category that you are looking to support with your jail program. So based on the information that you've gathered and the analysis that you've done through those 3 steps, you develop your local government pitch. First, you're going to take that data from step 2 and be able to make a statement like the following. Monroe County's non-fatal overdose rate is high compared to surrounding counties. Monroe County also has a lower than statewide average distribution of naloxone to reduce an overdose. From the step 3 data, you can see that the dashboard indicates that there are currently no reentry programs serving Monroe County jails that are funded by, the jail funded by the city, county, or state abatement funds. And the jail has also confirmed through offline conversations that you've had with your due diligence that the proposed programming is not offered through other funding sources and that they support the application. So really with this local government pitch, you're returning to a couple of these different sentences that allow you to make that strong case for funding. First, this proposal aligns with the following allowable uses in Exhibit E and/or Kentucky revised statutes. So you could explicitly tag those allowable uses to crosswalk your proposal with what is prioritized for this special funding. The second sentence that you would want to complete is the one we talked about earlier. We have whatever amount of a remaining balance in our county funds from which we would like to request a proportion in support of our application. Again, to make clear that you've looked at that overall funding commitment and portfolio and made a reasonable request within that overall investment. And you could stop at this step if you do not intend to apply for state funds. This becomes kind of the substance of your pitch to your local fiscal court with that support. If you'd like to then pursue, based on acquisition of that local support, the state grant application, looking at the cycle ahead, you would use that step 1 data in the following way. You would incorporate information into the proposal about how the project aligns with the allowable uses and state priorities. That's just good grantsmanship too, right? When we're thinking about how do I mirror back to a sponsor that I've seen and understood their priorities in what I'm proposing from my program. So using that kind of grantsmanship hook to show that explicit alignment with allowable uses at the state level here, a great way to strengthen the application. Second, you could use data we generated from step 2 to strengthen the proposal with the relevant radar data on local overdose trends, right? You're able to incorporate that real-time local data, the most up-to-date information that you can at the very local level on the need for this specific investment. Then with your step 3 data that you've generated with the work you did with the local government, you could secure a letter of support from local government officials outlining their commitment of county and or city funds based on your pitch. And this could include a description of why local funds are not available or why they aren't sufficient to cover the costs, really being able to show that local investment and why more is needed from the state to be able to supplement that. So I hope that's useful as kind of a thought exercise for how someone seeking this kind of funding from an executive director perspective might be able to analyze and use these data for a specific kind of program proposal. And we envision being able to continue to develop these use cases with actual end users over the next 2 years, where we're working with different folks who would like to not only strengthen their proposals, but also understand from kind of a civic level what's happening with these kinds of investments. So working really hand in glove with Kentucky Association of Counties and other partners to build that capacity for using these data, interpreting them to make good decisions and strong and solid cases for funding for different programming. So we'll turn it over now to you all for an opportunity for some Q&A on this exciting new product and the opportunities for learning and development of strong proposals that it presents.
Thank you very much, both of you, and to your entire team. We know there's a team behind that with you, and want to thank all of you for the hard work and dedication to make this a reality. With that, any questions or comments from any commission members?
I have a question. Suppose I'm not an executive director that is used to doing grants. How do we, I mean, it's great information. How do we make it, how do we simplify it? Is there a way to simplify it? The data is great. Is the goal to make people, help people apply, make their application stronger, and to lessen the number of calls we get here at the office for our staff who works very hard. So I'm looking at just local, small nonprofit in an area who's not as experienced. It's a great walkthrough, I get it. The information is wonderful. Is there a way to simplify it? Is there a way to not be so intimidating if you have no background in it at all? I'm just
yes, absolutely. That's another aspect of our work in partnership with the Commission and local governments and Kentucky Association of Counties. Myself and my staff member, Brooke Hiltz, who is also a part of the end user group for this dashboard development, provide technical assistance and implementation support to have those one-on-one conversations with folks and also explore what are the possibilities for evaluation, right? That's my area of expertise. So how can we help through that technical assistance to strengthen how they're doing the measurement piece cases. So that's really kind of our hope over the next 2 years, is to work with as many different types of end users as possible with different levels. Because we're thinking about here in this use case, an executive director who is, of course, very well seasoned in securing different kinds of funds, because you have to be in that role. But the use cases for an interested community member compared with a local government official, compared with students who are interested in policy work, might be different, right? So that's what we really want to be able to develop over the next 2 years, is working with each of these end users on that, and to also have the opportunity for that hand in glove. If you're like, okay, I really want to understand what this information means and what it could do for my program, being able to sit down with folks one-on-one and kind of learn about their use case through that technical assistance and consultation.
Thank you very much. And again, I must applaud the data and the information that's been put in there and the time I know you put into it. It's wonderful to walk people through. I write grants for a living in my day job, but what you've done is very concise information, very helpful. Thank you.
Thanks, Vaughn.
If I can make a quick comment, I want to thank Jesse and Jessica and Hallie and Michelle and everybody else that's worked with us, because they spent a lot of time thinking about what kind of information needed to be summarized. And so lots of thought and love went into this from the commission as well.
Any other questions or comments?
Just maybe a quick comment.
Absolutely.
So good to see you all. I'm Alan Brenzel with the Department of Behavioral Health, and we work with you all extensively. I know Dr. Katie Marks, our commissioner, is you're very familiar with, and so we have really benefited over time from your all's work, and it is really something as a Kentuckian that I'm proud of, the amount of data that is collected, analyzed, and the availability of kind of real-time data. So I'm just very excited to see the commission use your all's experience, talent, and it looks like this site is able to direct people to a broader set of data around other funded projects, and the lock zone distribution is more than what the because you have your link to your overall radar site on here is right. And so I really think it's great that folks who are interested in finding out what's happening will be able to I haven't had a chance to look through here yet, but it looks to me like it's very valuable. And one clarification, so commission trust fund, that's this 50%, is that what we're referring to this? That's a little confusing to me that this is called the trust, but I suppose, is that the legal term for the funding that comes from this commission? Yeah.
Did you want to speak, Chris?
Yes, it is. That was a discussion that's taken place a lot about what that term looks like and what that needs to be to make sure that it's understandable by an individual. So we appreciate that comment, because there was a lot of thought going into that, and continued discussion about what things look like as we move forward, and hear from the communities about what makes it simpler for them.
Because I think that's helpful for us as we review these proposals to know what from this commission has already been awarded to that county, and then to be able to quickly look at what that county has done. And you know, I think that'll be very helpful for us going forward as we review proposals.
Yes, we actually, one of the use cases we envision working with you all on is what's useful to you all as the commission, right? And how could you use the dashboard to help with informing your priorities for the next cycle, and also how you're evaluating that local match and investment and duplication of services.
Any other questions, comments?
One question. Thank you for all the effort. There's some deep thinking that's gone into this, and a lot of hard work. How does the system refresh itself? How do you know that more money is being spent in one place and another, and that more money is being spent, whereas the week before when you checked it, nothing was being spent at all? How is the refreshing process accomplished?
So right now, the data that we receive from counties and cities is obtained through the end of fiscal year local reports. And so on an annual basis, we'll be updating the site as those local reports come in and are reviewed by the abatement staff. They will then be made available in a batch. We think around September, October is what we're hoping for.
Sure.
And so there'll be a batch release each year in the fall.
I see. So it doesn't periodically refresh. It's a annual refresh.
Current reporting requirements are simply annual. And so that's the best that we can do right now for looking at counties and cities. And then as new awards are distributed, we'll update as that data comes in the investments by the commission.
Do you send, a digital report to each county judge executive, or the authority within the county that's administering funds?
So I'll hop in as it goes to that. I think one of the key things for this and the ask to them has been to address the transparency issue and to make sure that people have the power and the knowledge to access this. The wonderful thing about this is this now gives the same level of clarity to anyone in the Commonwealth as it does to any researcher or any student or anybody looking at it. They have that same access to data and information. Again, the key partnerships and the work that takes place amongst the staff as well as the University of Kentucky to help drive people to where that answers are is key to it. But what we've really asked for that is that transparency to be turned up to a level which is basically unparalleled, to be quite honest. I mean, there's a couple of other states who are doing that, but this is as real as it gets. Hence the discussion point earlier about the importance of the local reporting coming up, because that next wave was what will be able to populate the local reporting. And as we make decisions in terms of funding allocations, that will get populated at those times. But for the counties and cities, it's going to be on that yearly basis because that's what we can get to them at this point.
Got it. Of course, the same officials that I would referred to, they can access it just like anyone else. So are they aware of those kinds of opportunities? Or are you?
I can answer that for you, sir. So the local judge executives or treasurers or clerks, they get regular communications from us. They get warnings of their deadline opening on July 1 and that the deadline is August 31st. And a year ago, this team launched the actual online reporting. So it is all digital. They have access code. They go in, they fill out the report. It requires them to put in the financial information about how much money they received in the year, how much they dispersed in the year, and then any entity that received funding gets an email survey that asks them to talk about what they're doing with that funding and any impact. And it all flows through the system that Rador built for us a year ago. And so it's a seamless it's not seamless because Smith and his team behind them has built out a really complex data process, but they can take that information and it's all happening in the system. So it will only have new information to put into the system in that annual report. But we do anticipate it will get updated quarterly as reports might get revised or changed. There will be opportunities to refresh it, but the major points will be in that October timeframe where you'll see a bunch of new data, or right after our grant awards are released in July.
Got it. Thank you, ma'am.
Can I also chime in? This also, I think, relates to what I was discussing in terms of end user engagement. And we are planning to have sessions with Kentucky Association of Counties to do that training, because if folks aren't the local reporters, maybe they don't have that access. They aren't getting those emails, right? So we want to really take advantage of the footprint and the reach that Kentucky Association of Counties has and their leadership in this space as well, to be able to do trainings directly for local government officials of how do you get hands-on with this dashboard to be able to have all that kind of visibility and understand what your constituents are seeing. So I think that will be another kind of element of this, how local governments are able to use the dashboard, in addition to all the hands-on work that Jesse was describing, the opportunity to engage in different kinds of learning sessions really targeted to local government officials.
Thank you, ma'am.
Seeing no further questions, again, thank you very much to you and your entire team. Please express our thanks to them. This is transformative in terms of the way that people will be able to see where the dollars are going across the Commonwealth. So thank you very much for your work. We appreciate it. With that, we'll move into the next phase of today's meeting, which is for public comments. I'm going to cover a few things that it looks like we've got at least somebody who's signed up. 3 to 5 minutes is the time frame that we provide for those. We're looking to get input to help us identify funding priorities for the next round of grants. Understanding why you're here is important, but please remember to focus on your time on what you want us to learn from you being here today. And it's also not an opportunity to lobby for programs to receive grant funding. We want to make sure that it's an opportunity for people to inform us about things, but it's not part of the grant process in terms of that. So I want to put that out there. I've got one name currently signed up to speak, and that is Kim Webb from the Emergency Shelter of Northern Kentucky. Oh. Oh, okay. Yeah, that's fine. That's we'll just, yeah.
Yeah, exactly. I appreciate it. On behalf of the Emergency Shelter of Northern Kentucky and Covington, I want to thank the Opioid Abatement Commission and everybody involved in this process. I wanted to come today and make the trip solely to give you an idea of the impact that this funding is having in our region, some of which is known, some of which is not known. Number one, we have focused solely on our guests, but the impact on our staff. Employment opportunities for our adults that we hire with lived experience has had a 27% increase since 2024. With this funding, we've been able to focus on hiring folks with the understanding that we can send them through peer support training, which makes them better employees for us and longer tenures. One of my favorite stories is someone who stopped me. We were at an Outstanding Women of Northern Kentucky luncheon. She is our current navigation coordinator, and she had shared with me that she was living in a tent in Boone County for years. And she is, like I said, currently we hired her while she was in a sober living facility. And we were at this amazing event. She said, "Look, Miss Kim," that's what she calls me, "that's the tent, that's where I slept by Turfway." And the ability to hire folks and provide them professional opportunities is a result of the funding we received. We were also able to send 16 individuals through peer support training, their professional development, opportunities to event the statewide conventions and those kind of things. And we currently have 7 of them. The rest have moved on to other employment opportunities. We also have had opportunities for increased funding opportunities with partners. Most notably, Vital Strategies reached out to us and wanted to partner with us to provide harm reduction, overdose prevention, outreach during extreme temperatures, because in Northern Kentucky we serve as a cooling center, opening up our doors during the day for individuals that would have no other access or services elsewhere, and winter sheltering. But that opportunity with Vital Strategies is because of the partnership we've had with the Opioid Abatement Commission. The also most recent run is the inclusion with the Office of Drug Control in Northern Kentucky, who has expanded to include emergency shelter bed funding. And while we're still working on those details, it is great that we are part of that conversation for the role that we play in our community, because in the end, the commission has very clearly continued to focus on boots on the ground. I remember that town hall in Covington, and you all said, boots on the ground. We want to get this dollars to the boots on the ground. And that is what you've done by granting us funding to be able to do that. We're going to report out the rest of the fiscal year, but I just wanted to take the time, make the trip to thank you and everybody involved in this process, because the impact is far beyond just keeping a guest alive, getting them to sober living. It's also about employing them. It's also about that impact and the other ways that we at the Emergency Shelter in Kentucky continue to be in our community. So thank you.
Thank you, Kim. I had the pleasure of visiting, as you know, your center on a summer day, and to our fellow commission members, what they do is just remarkable. The amount of people they serve and how they serve them, with no more funds than you have and no more space than you have. It's one of the it's a great thing about a site visit. You get to see where the money went, and I'm very proud of your program. I'm proud we were able to fund it.
Yeah, I appreciate that. Last year, over 18,000 emergency shelter beds. We are the largest and really the only low barrier immediate entrance shelter in Northern Kentucky in the ad district for our community. And, over 900 adults reported SUD, mental health, or co-occurring in that regard. and over 1,000 clinic visits. So we also are the shelter that has dedicated clinic experience that partners with NACU on NKU's campus, but most also UK College of Medicine students who are getting firsthand experience in urgent boots on the ground care. So the reach is wide beyond the individuals, and I just wanted to take that time, like I said, and thank you all.
Thank you very much. Appreciate it.
Yeah.
Thank you. With that, that concludes our public comment section. Next, are there any commission members who have announcements that they'd like to make at this time? All right. That is a no. And for next section is for new businesses, and we have no additional new business today. So with that, I will ask for motion to adjourn.
Move to adjourn, but Mr. Evans, I just want to thank you for the shepherding that you've done over the last year. You are a constant source of strong leadership, and you've provided all of the commission members through the staff with excellent direction and questions answered in real time. I really appreciate all that you have done.
Well, thank you. I just will want to make sure to say, whenever I hear that, I always have to remind people that we have the best staff in the state of Kentucky. I will constantly say that and put them up against anybody at any time, any place. So thank you for that. And I just get the opportunity to be the face of what they do. So thank you very much for that. And with that, can I get a second for the adjournment?
I second it.
All right. Any discussion? All in favor? Any opposed? The motion passes. We are done for the day. Thank you very much, everybody. Thank you very much, team.